Okay, ma'am.
Okay, so if you've read and understood considering a surgical pathology station, please tell me how would you manage this patient?
Okay, ma'am. I'll consider this is a trauma patient and having the sickle cell disease and the brain tumor. I'll consider the ATLS protocol for the management of this patient: airway, breathing, circulation, spine immobilization, uh, and mobility of his different organ and
Okay,
level of the consciousness.
yes, what would you do next? Now she has been brought to you. How
Yes,
would you go about and how would you manage this patient?
I will manage the patient in multidisciplinary team approach. I will consult with the neurosurgeon,
Okay,
the radiologist.
right. And considering the fact that patient is known case of sickle cell disease,
Yes,
why
hematologist also I will consider.
yes, why is it important for you to know or how management of the patient would differ because patient already has a sickle cell disease?
Yes, there is some complication may occur in the patient having the sickle cell disease.
What is sickle cell disease, please?
Yes, sickle cell disease is a hereditary, it's a common hereditary hemoglobinopathies. There will be the mutation in the beta globulin, which proceeds the polymerization of deoxygenated hemoglobin, leading to the red cell destruction, hemolytic anemia, microvascular obstruction, and chronic tissue ischemia.
Okay, please tell me which amino acid is replaced by which?
Yes, valine is replaced by the glutamic acid in 6 amino acid position.
Position. Okay. Knowing the fact that patient has sickle cell disease is a risk factor for what?
It's a risk factor for the vaso-occlusive disease and the sequestration crisis, aplastic crisis, chronic tissue ischemia, and increased susceptibility of the encapsulated organism, infection by encapsulated organism.
Okay, please tell me what is the normal hemoglobin level of a patient suffering from sickle cell disease?
Usually 4 to 6 milligram per DL.
No, you're telling me less. 6 to 9 approximately.
Sorry, ma'am.
Okay, right. Can you define the term sickling? What do you understand by the term sickling?
When the hemoglobin attached to the neighboring hemoglobin, they become the sickling and lose their normal biconcave shape.
Okay, please tell me what is the surgical relevance of this condition?
Yes, ma'am. There is some surgical condition like the gallstone disease, autosplenectomy, avascular bone necrosis, osteomyelitis, pulmonary hypertension, heart failure, acute cholecystitis, and the bowel necrosis.
Yes, but the main thing you have forgotten
Gallstone,
is the
ma'am.
high risk. See, you
Autosplenectomy,
yes, but
bone
if
necrosis.
yes, wait, please. If you are going to operate on this patient, right, just on the basis of that there is a discovery of random mass in the brain and patient has presented in accident and emergency unconscious, and if you'll operate on this patient, what are the risks with that? What are the complications that can occur to a patient who has sickle cell disease under general anesthesia?
Yes.
A lot more easy.
Yes.
What are the okay, you could not answer. So next question is, what are the principles that you have to follow in order to avoid or take care of while managing this patient in
Yes, I will at first I will discuss about the patient with the anesthesiologist. I will maintain the adequate hydration and oxygenation.
yes, and how does it affects the use of tourniquets on patients with sickle
Yes,
cell
I will.
disease?
Is about the tourniquet in
Yes,
surgery.
yes, you should use them with caution. Why?
Yes,
Okay,
it will aggravate the sickling more.
all right, yes. All right, please tell me when you have to consider acute complications, there is a term called painful crisis. Can you
Yes,
explain this term, please?
yes, painful crisis had that triggered by the infection, dehydration, and acidosis, which cause the acute bone pain, that is the bone necrosis, chest, lungs problem, acute lungs and chest syndrome. When affect the brain, there will be the stroke. In the eye, there will be the retinopathy, and in case of the spleen, there will be the autosplenectomy.
Okay, right. Which organisms are more susceptible to affect or act on patients suffering from sickle cell disease?
Yes, the encapsulated bacteria, mainly the Haemophilus influenza, Neisseria meningitis, and Streptococcus pneumoniae.
No, it's parvovirus B19
Oh,
infection.
yes, sorry, ma'am. Yes, parvovirus. Yes, ma'am. Sorry.
All right. This autosplenectomy can lead to which conditions?
Increase the susceptibility of the infection of the patient.
Right.
That is
Adults
post.
who present with brain tumors, what are the most common primary brain tumors in elderly patients, please?
Yes, ma'am. In primary brain tumor, there is high grade and low grade. High grade includes the glioma, glioblastoma multiformis, medulloblastoma, and the low grade includes the acoustic neuroma, neurofibroma, meningioma, pituitary tumor, pineal tumor, and craniopharyngioma.
What are the manifestations of this brain tumor if remain untreated?
It depends upon the location, rate of the growth, the space occupying lesion, and the rest intracranial pressure. It includes the headache, mainly the morning headache, nausea, vomiting, seizure, focal neurological deficits, cognitive and behavioral symptoms, papilledema.
Okay, what are the consequences that you should expect if you if you decide to do not operate the brain tumor?
Yes, and increase the intracranial pressure that cause the herniation of the brainstem and which affects the respiratory center and patient may die.
All right. Just suppose you've done the brain biopsy and the result comes back and it shows that patient has squamous cell carcinoma with keratinization. What is the relevance of knowing this?
It's maybe the metastatic one, and the source may be the skin, the esophagus, nasopharynx, lungs.
Very good. Yes. Okay. All right. Post-operatively, patient's wound does not heal easily. Rather, it becomes infected. What would be the most common organism affecting it?
Staphylococcus aureus, ma'am.
All right. And then what you realize that this wound contains a fluid which is rich in glucose. What is the significance of knowing this?
There will be the communication with the CSF.
Cerebrospinal fluid. Okay.
Yes, ma'am.
All right. Good. Thank you.
Thank you, ma'am.
All right. If a patient complains of bony pain, how would you interpret that?
It's a sequestration crisis,
Yes. Good.
vaso-occlusive.
Thank you. Good.
Thank you, ma'am.